WKZO News Time, 8:40. Time now for our Bronson Med Chat. And today it's going to be all about treatment for hands, wrists, and elbows. Sounds like me, Dr. King. I got to tell you. It's, the older you get, it's like, boy, is my joints supposed to sound like that? I don't think so. So we are joined by Dr. Jeffrey King this morning. Good morning, sir. How are you?
I'm very well, thanks. How are you?
I am upright, which is a good thing, too. Tell me, I got to know this, because I'm telling you, other than the fact that I'm getting older, what are some of the common causes of pain in the hands and the wrists and the elbows?
Well, as you alluded to, pain in this area is very common, and we see it a lot. It keeps us pretty busy, obviously. I think some of the things that are really common, and probably most of your listeners can relate to either of these problems or know people that have these problems, are things like carpal tunnel syndrome, things like trigger fingers, and also kind of arthritis and tendonitis. Now, arthritis is kind of an irritation or inflammation of your joints in your hands and your wrist or your elbow, and tendonitis is a little different. It's an irritation, but it's an irritation of the kind of muscles and tendons in the area. And that's kind of the big groups of things that we usually see around the wrist and the elbow and the hand.
Now, I was joking, but I mean, obviously, aging does have something to do because things deteriorate. I mean, that's all there is to it. So, do you lose some of the? And I'm going to have to fall back on my anatomy physiology here. The cartilage that's in between joints and things like. As we get older, does that get less pliable? Does that get less flexible and things like that? And that causes some of the issues too.
For sure. And the things that you were just alluding to or that you were just talking about are the arthritis kind of problems that we see. And that's particularly true at the base of the thumb, where your thumb kind of meets your wrist. That's a very common place to get arthritis and cartilage wear. And then also the little joints in your fingers. And many of your, more experienced, we'll say, listeners may notice that they have finger stiffness when they wake up in the morning, and it takes a little while to get their hands moving. And that's very common. Those issues are not really as much of an issue, don't cause carpal tunnel and trigger fingers. That seems to be sort of a different problem, which is not quite so much related to age.
We're talking with Dr. Jeffrey King of Bronson Hospital. Dr. King, you mentioned a couple of conditions. Let's take them one at a time, and the one that people are really familiar with, obviously, is carpal tunnel. What can you do to treat this?
Well, obviously, the first thing that we need to do is make sure we've got the right diagnosis. And so a careful physical examination and taking your history is the most important thing to make the diagnosis. But carpal tunnel is really a problem with too much kind of pressure on one of the nerves that goes into your hand. And so once we've kind of made that diagnosis, we think that's what's going on. There are several options. Some of the easier things to try is you can get a wrist brace. You can pick that up at any of the, at a drugstore or anything like that, and that just kind of keeps you from bending your wrist down when you sleep at night, and that can be very helpful. Kind of trying to avoid the activities that bother it, especially if it's kind of a new thing, you've only had it for a couple of weeks, that can work. Other treatment options, you can try and do steroid injections, that works about half the time, or surgery, which is certainly a little bit bigger deal, but the surgery for this problem, if that's really what your diagnosis is and you've had a careful, thoughtful talk with your doctor, that works about 95% to make people's numbness and tingling in their hands go away.
All right, so Dr. King, let's take trigger finger. What is that exactly, and how can it be treated?
Trigger finger is kind of a cousin of carpal tunnel. One doesn't cause the other, but people that have one can have the other. And the common enemy, so to speak, is swelling around the tendons. When you get swelling around the tendons kind of in the front of the wrist, you get carpal tunnel. When you get swelling around the tendons further out closer to the fingers, then what happens is the tendons don't glide so well through the tunnels that they need to glide in. And so the tendons kind of get stuck, and that can cause clicking and popping in your fingers. Sometimes that's painless. It just kind of looks weird. But other times it can be quite painful, and the treatments are fairly similar. You can try an injection that works about half the time, or with about a 10-minute surgery, you can take the pressure away, take the size mismatch away, and make trigger finger go away once and for all. Now, of course, that's obviously a talk that you need to have with your doctor about whether that's the right thing for you, but in the right situations, it can be a very effective treatment.
Talking with Dr. Jeffrey King here on our Bronson Med Chat on this Thursday morning. All right, so Dr. King, I understand that there's an event coming up that if you have questions, things like this that you really want answered, that you're going to be at a location where people can actually show up, ask you questions, and learn more about these conditions.
Absolutely. There are lots of different ways that you can get information, but one of the ways that myself and Bronson are kind of trying to help answer people's questions is I am going to be giving a presentation on Wednesday, May 27th. It's at the Bronson Athletic Center. And it's going to be from 6:30 to 7:30 at night. And so I'll be there. I'll give a little talk about kind of common problems, and then we're going to leave lots of time to try and answer people's questions. I'm not going to be able to make diagnoses or give people specific treatment advice, but certainly can give your listeners who are interested some information. Now, they can register for that online at bronsonhealth.com, or they can call Bronson Health Answers, and I have the number for that as well. It's 269-341-7723.
Now, are there any websites that people can get additional information from?
Sure, absolutely. There's lots. The Bronson Hospital has our office has a website, Bronson Healthcare, but there also are websites. The ASSH is the American Society for Surgery of the Hand, ASSH.org. And I encourage people who are looking for information on the internet, I tell them kind of stay on the main road. If you kind of go to one of those websites or Mayo or Harvard or any of those kind of places, you're fine. And once you kind of get off the main road, the information becomes a little less reliable. So there's information out there, and most of it's good, but you have to be a little bit careful. And I certainly encourage people, if they have any questions or concerns or want to hear an overview, to come out and we can talk.
And that is, of course, on May 27th at the Bronson Athletic Club. You can see Dr. Jeffrey King in person and get all sorts of information. As you want, again, go to bronsonhealth.com/classes or call 269-341-7723. Dr. Jeffrey King joining us this morning on our Bronson Med Chat. Dr. King, I wish you a safe and prosperous Memorial Day weekend. Thanks for joining us today, and we'll look forward to seeing you on the 27th.
Great. Well, thanks very much. I hope your stiff hands feel better.
Thank you, sir.